Hello, I'm Dr. William Berger, owner and founder of Northeast Medical Practice. We are a primary care, weight management, and aesthetic medicine practice located on Long Island in Great Neck.
Good afternoon, and I'm Irina Berger, co-founder of Northeast Medical Practice, and I also perform administrative director functions at the practice. So, Dr. Berger, today we would like to talk about my weight journey.
Exactly.
Right?
So I wanted you to share with our audience what it's been like in terms of lifestyle and any other ways that we've worked together on your weight and
Yeah,
overall
absolutely.
health, of course.
Absolutely. It's very vulnerable topic, right? I mean, health. And I have been struggling, like, throughout my life, I never had any issues of losing weight. I always was extremely active. Even after giving birth to kids, I was, able to relatively quickly to lose weight. But really, weight hit me during my premenopausal. For about 3-4 years, I have been struggling, and things that they were working before does not work anymore.
It's something I very commonly hear.
Right. I mean, I have been, doing exactly the same thing. Like, I'm eating relatively the same. I, went to the gym at least 4 times a week, 5 times a week. And this development of your tummy, right, it started growing right from here. And when we talked, you mentioned it's all from drop of estrogen, right? I mean, because of the hormone.
Right, so abdominal adiposity, carrying your weight here as you approach menopause is very, very common.
And as when you started this medication, it took me some time to start reacting to particular medication. I mean, I believe you started with Saxenda. I was not successful. Then you placed me on Wegovy, which is also was not, my appetite and my hormone cravings. Like, it doesn't matter how much I ate, I was constantly hungry, and and it was really, really hard to manage weight. It was going up and up and up and up, and until you placed me on Zepbound. And it's interestingly enough that for the first time when you placed me, it did not work as well. And I believe if you want to share those.
Right, so first of all, everybody responds to each medication in a different way. It's very individual. And Saxenda is a very early GLP-1 receptor agonist medication, not nearly as effective as the newer ones. So Wegovy and Ozempic and Zepbound and Mounjaro, which are semaglutide and tirzepatide respectively. So, not too surprising, that has maybe, a 5-8% weight loss at the most. Also in the studies for the other medicines that I mentioned, often 5 to 10% of people are non-responders for whatever reason. It hasn't been entirely worked out why certain people don't seem to respond to the medicines, but a small proportion are non-responders. And so for you, the Wegovy did not really cause any weight loss for you. Zepbound, I believe you got to the middle dose, to 7.5 milligrams, and I think more due to some skincare products from outside. You had some rash, and we just wanted to make sure that it wasn't the Zepbound and so forth. So we stopped. We waited a while, and then we restarted. It hadn't induced very much weight loss the first time, but now you've just completed the 7.5 milligram level and moved on to the 10, and we've had some success. So maybe you can talk about that.
Yeah, I think absolutely the fact that I started working with Peter, and it was
This is
very
our exercise
as
physiologist.
exercise physiologist. And not only he created phenomenal program in terms of strength training and cardio, right? He also talked a little bit about the keto diet as well as intermittent fasting. Like, I am so programmed to eat 3 times a day, right? I mean, breakfast, lunch, and dinner. And he says to me, if you're not hungry, why are you eating breakfast? Like, are you hungry when you wake up? I said, no, I'm not. So he said, why won't you stop eating breakfast? I stopped eating breakfast. So my first intake is usually around 1. And the second thing he also mentioned about keto, and he was like, why are you eating carbs? If you want to lose effectively and very, very quickly, you got to cut out on carbs. So I started doing that, and
Mhm.
basically, but again, I would never recommend to go to keto to anyone until they speak to their physician,
Mhm.
because I know if you're having like kidney stones, or if you're having certain,
Exactly. There are certain people who should not embark on a keto diet. So yes, it's very important to speak to your physician about it. But in general, carbohydrate restriction of some kind, limiting carbs, is often a very good way to lose weight. And in terms of the timing of your diet, so time restricted eating is what you're referring to. Intermittent fasting being more, nothing but water for 2 days and then to eat. So time restricted eating, often people do an 18 off 6 hour eating window on. It can work for a lot of people because you just don't cram as many calories into the smaller eating window. But when it comes to diet, it's very individual. I really work with patients in terms of whatever works for them, because some people like me, if I don't have at least a shake in the morning, a protein shake of some kind, I become a little bit ornery,
yeah.
a little moody. So whatever works for people, however you can control the total calories for the day.
Right, and I do think that after you getting into the groove of habit, it becomes like a second nature,
Hmm.
right? I mean, in the beginning, I was like, oh, it's weird, like I'm not eating breakfast, but now it's like I don't even think about it. Like I'm
Hmm.
running around, I'm extremely busy. I go to the gym in the morning, and I'm drinking a lot of, consuming a lot of water, coffee, right? But meal is not as important, right? And I also think it's also culturally, like I
Hmm.
remember, growing up in my parents' household, right? I mean, whatever they put on your plate, you definitely have to finish. Like it's not customary to throw away food, and we also express love through food. Like
Hmm.
if you're not going to eat, you're going to offend me. I put effort, I cooked for you. So this is entire relationship with the meal. It's actually changes when you start taking this medication. It controls, suppresses your appetite, and it also controls your portion. You cannot eat more than you can eat,
Exactly.
right? So you're taking a little bit of, and we also teach our patients to start with protein, because protein intake is very important. And I do believe that, you also give, like if somebody goes on keto, you're having a particular guidelines. It's not like you can eat unsaturated fat as much as you want. Like you still have to control, half of avocado, a couple of
Right,
eggs,
right.
like
You want to actually focus. If you're going, you want your fat to be unsaturated. The saturated fat in beef and pork and things like that. Some folks, their LDL cholesterol can really spike if they go keto in that way. So another reason that you really should do this under the supervision of your physician, so that your blood work is being
yeah,
drawn and all that's being paid attention to.
and again, like even being working at Northeast Medical Practice and taking advantage of all the programs, I can attest that it's working, right? I mean,
Hmm.
it's really, really, in 3 months I lost 15 pounds, which was very challenging for me throughout those 2 3 years. Like as I said, I have never struggled as much as I
Hmm.
did this time around, but I'm extremely happy that it's and I'm not even on a higher dose yet. I'm actually on a very, I just increased to 10 milligrams yesterday,
Hmm.
so it's still room for, to increase.
Hmm.
And
If we need to, yeah.
I have
Hmm.
noticed that on Monday, like if I'm taking medication on Wednesday, Monday I become extremely hungry again. Like this is something Monday, Tuesday, I'm
Hmm.
actually struggling because
Yes,
it's not
for
enough.
the half-life of these medicines is 1 week, which is why they're dosed on a weekly basis. That means only half the medicine is left in the body by the time you're getting to your next dose. So this is a common thing that we hear about. That's another reason why it's so important to have the proper lifestyle, diet, exercise, etc., in place underneath it. And at higher doses, more of the medication will be present at the end of the week. So for some people, we go up to the maximum dose, but this is also very individualized. if I can use a lower dose of medicine, I'm all for that, but we just see how it goes with each patient.
I just want to express my gratitude. It's really, really you changing lives. And again, there is so much stigma around weight, and you know, especially in Eastern European culture, like women have to be petite. I mean, she has to be very, you know, European designers, they don't even make large sizes. Like they all go up to 6 and this is it. Like, so I can't even tell you how important it and how much it means. And of course, you know, the health aspect, right? I mean, the numbers becoming better, and I haven't done my blood work yet, but you know, I'm sure that it's going to reflect the new weight. And I'm very, very grateful for everything you do on behalf of my daughter, on behalf of myself. And again, I also think those medications, they're revolutionary, and you know, but it has to be uh, you know, prescribed by someone who really understands what can benefit and what can harm you. I mean, contraindications, what goes with what, how, and the quality, I really much appreciate. Thank you for everything.
Well, it's my pleasure. I'm always very happy when we have successes like this, and it's the reason that we do what we do, to improve health, improve people's confidence. You know, this is the rewarding aspect of the kind of work that we do. So I'm very, very happy that we're making so much progress with you, with so many of our patients, and thank you for everything that you do in the office as well. We if it wasn't a team, it wouldn't happen.
Of course, thank you.
Of course. So I'm Dr. William Berger again. This is Northeast Medical Practice in Great Neck, New York. If you'd like to learn more about us, you can give us a call in the office, 516-604-3418, or visit us online at northeastmedicalpractice.com. As always, everything that we chat about here in our videos is for educational purposes only. We have not yet established a doctor-patient relationship, and you should see your physician for any concerns that you have. But in the meantime, be well, and we hope to see you soon.
Thank you.